Thank you. No, it's great to see so many of you still in the room and not rushing out for tea and coffee. Uh, and I know we have a couple of other speakers after this, so I'll keep it snappy. We'll make a couple of changes, right? One, you may hear me talking at 1.2x or 1.5x of the speed if you're used to YouTube videos. So bear with me as I try and rush through some of these conversations. I'm Krishna Thakur from Gates Foundation. It's a privilege to welcome you to this important conversation on urban livelihoods in India. You know, we truly, and I'll keep the back context about 2 to 3 minutes, and then we'll dive right into some of the sort of insights from our fantastic speakers. But we're truly at a turning point, right? For the first time in our history, more Indians will live in cities than in villages. You know, the next 2 decades, we'll add about 400 million residents to our cities. And that means most of India's sort of Viksit Bharat goals, aspirations, future will be urban. Now, whether we plan for it or not, right? Now, to match the scale of this shift, you know, India will need to create about 100 million new non-farm jobs. And in addition, you know, transition about 100 odd million informal jobs into especially women and migrant workers, right, into more secure, not necessarily entirely formal, but somewhat visible and supported livelihoods. Now, that is a mammoth task, and we are attempting it at a time of enormous disruption, right? Artificial intelligence, climate transitions, digital platforms, and robotics. So when Professor Tantri was making the presentation about dosa as something, as a skill that's not being, I mean, I really enjoyed his presentation. But a scary thought, and I don't know if you've seen robots making dosas these days. So I mean, we're looking at you know, the future is really uncertain on many of these sort of things. But we've also seen what's possible, right? I mean, PM Swanidhi, I think it's an absolutely stellar success over the last 3-4 years. The Kerala ultra poverty model that ma'am shared about, I think both are some absolutely terrific models that you know, on PM Swanidhi, about 10 million street vendors, right? They accessed ID, credit, digital payments, entitlements, and dignity. Most of them for the first time. It's a proof that we can design systems that can include the most excluded at scale and at a pace, you know, when we act intentionally. Just 3 areas that we'll focus on for our conversation, right? Around, I think there are 3 themes. One is formalize, 2 is financialize, and 3 is digitalize. And now to discuss and deliberate some of these points, we're joined today by a unique mix of leaders from government, civil society, and the private sector. We're supposed to have Manisha ji from Amazon, but unfortunately, due to some personal exigency, she could not join, but we're well represented. And solving society-scale challenges like this takes all 3 working together, right? Public, private, and community partnerships are not just good to have, they're necessary. Kind of, you know, I'll keep this brief and let's get started. Dr. Sreedevi is with us, and you know, ma'am, you've been a leader in making urban poverty visible, right? Our conversation around sort of your insights and lessons from a bottom-up model. You know, what stood out for me is how deeply you've tried to listen to people and not just count them. Could you walk us through sort of your journey, the lessons and insights from that participatory poverty appraisal, and how you're using those insights to shape a more inclusive program?
Do you have time for a PPT or just talk?
However, ma'am, 5 minutes, and then we'll keep and I'll urge all the speakers to keep their response to about 3 minutes. Thank you for asking, if that's okay. Yeah.
I will keep it to 5 minutes. If I can take you through quick, it would be easier to impress. Friends, how many of you have heard about helicopter parenting style? All of us? Yeah, in order our kids do not fail, we try to micromanage. That's exactly how livelihood projects are. So when we think about how are they designed, they are always top down rather than bottom up. What I'm talking to you today is absolutely nothing rocket science. It's an age-old participatory methodology that we have learned during our careers, where we feel that what is the voice of the stakeholders, how do we capture them, and how do we make it program or a proposal for it. So we did one NULM 2.0 we were trying in a small town called Sangareddy. It is on the Bombay highway, around 60 kilometers from Hyderabad. So we did this exercise there in order to capture what is the need in the local bodies, especially in the sector where we are talking about Antodaya and we are talking about TOD and others for wealth creation. Then we should see that none of them are left behind. So this small exercise was done by my team. They are here, Chaitanya is here from MEPMA, as well as my team Murli Mohan is here. They went to this town and they did this exercise, so I'll take you through very quickly. The context was actually an appraisal. We wanted to do a poverty appraisal, so we have taken 2 wards in the municipality for our study. And the methods that we have followed are basically transect and other participatory methodologies like focus group discussions, stakeholder consultation, and surveys. This is everybody knows, and we wanted to identify who are the most vulnerable groups, or what are the vulnerable groups in the municipality or in the selected wards. So this was the exercise, and one good thing in Telangana as well as Andhra is that we have a mission office. It is called Mission for Eradication of Poverty in municipal areas. This has established itself in dealing with or in implementing most of the urban poverty programs across since almost a decade and a half. So this MEPMA has been at the forefront with their state level coordinators as well as the district level coordinators, and we have resource persons at the ward level where they participated in this exercise. And we have done a simple survey followed by focus group discussions. So this is about the statistics. I will not go because location is not relevant, and so the data is not relevant here. But if you look at the caste profile, basically they are Hindus BC, minorities and Hindu SCs. And what are their loans and indebtedness? If you look at that, the loans come from money lenders, relatives, and from self-help groups and banks. And housing also we have taken in, because normally when we do a socio-economic survey, we also look at housing, because affordable housing becomes an important initiative in addressing poverty. So this is the fabric of those 2 wards. If you look at majorly in the informal sector, domestic workers top the list and auto drivers. Then when we talk about this, does NULM 2.0 that we are designing is catering to these requirements or not? That is what we would like to pose questions. So when we came up with who are the people living in this and the most vulnerable groups identified, we also went into how is their economic condition, situation, and what are the houses, are they living, skill, and other things. But we didn't stop here. We went and actually spoke to them and talked to them about what are their expectations from the government. So here are the different vulnerable groups who have been identified. The construction workers talked for continuous employment, because this is very seasonal. So they were talking about continuous employment. Domestic workers or women caregivers were talking about safety, because when they get into the house to work, their safety is something that they would like to protect. So having an ID card or some kind of a identity helps for them. And second thing also, that lot many times, even if there is a small theft, these are the people who are vulnerable, who will reach the police station as victims. So these are certain issues that came very clearly on that. Then we talked about gig workers, transport workers. They mainly wanted, support for vehicles. This is something that we can do through our economic support, and also for grievances redressal. Then when we were talking about waste and sanitation workers, of course it is about their health and protective gear that we give them. So likewise, we have talked about what are those things which the agency can perform by itself. So we mapped what are their aspirations and what is that we need to do. Rightly so, Isha has mentioned in the morning that convergence is necessary when we do projects, especially the sub-schemes of Amrut. We looked at how the self-help groups are involving themselves in water quality management as well as maintenance of parks. and sanitation. Similar is here that what MEPMA can do, what NULM can do, what other training partners can do, what the welfare departments can do, and what are the banks or the financial institutions they need to do in providing the support. In fact, I would like to tell you that because of this bottom-up approach, today we can say that PM Swanidhi is very, very successful. Because if I go by the story, the street vendors actually take every morning 100 rupees. They are given 90 rupees, and then in the evening they pay back 100 rupees. That is 10% per day. That was the thing that they used to face. And Swanidhi, when it came in 2020, when COVID came in and they lost their livelihood, government thought about how to give them a support. They came up with this 10,000 rupees as a credit. So this is one which has hit the nail. That's why PM Swanidhi was successful. I'm glad that the professor from ISB in Hyderabad has come up very strongly on that. And I totally believe that unless our projects are bottom up, they are prepared based on the actual requirements of our ULBs, especially in the slums or the wards where there are where the poverty mapping is done, then only the programs will be successful. So if you want to unlock the potential and come to the best to eradicate poverty, we need to definitely participate, have a participatory methodology as well as schemes that will involve people. Citizen engagement is the key for a success of a program. So this is what I thought I should take you through, and thank you very much for giving me the time.
Thank you so much, ma'am, for taking us through that journey very, very quickly. And of course, I think both Telangana and Kerala are fantastic examples of bottom-up planning. Now, Rajan ji will come to you. He has a flight to catch. So,
flight's taking off? Are they taking off today? Okay.
A wedding to attend in the evening in Mumbai. Sorry if I'm spilling too much information, but he's the chair of skilling committee at NAREDCO, and is we all know it's one of the largest sectors in the country, one of the largest employers perhaps, and your work around at NAREDCO and the skilling committee has brought attention to a critical but often invisible workforce, right? And the need for skilling and recognition that we were briefly discussing. So why do you see formal skilling and certification not just as social good, but as a business imperative, right? And what can sort of cities, industries, and missions like NULM do differently, and even the skill mission, ma'am is here, to drive uptake and demand at scale?
Isha ma'am, thank you very much. Second, congratulations, because the way you have taken this entire conferences, you have given a tough to all private organizations who do the conferences and all the seminars. Hats off to you. A round of applause to Isha ma'am too. Yeah. Krishna ji, here I would like to tell of skilling and housing for all. The credit goes to only one man in our country, that is our Prime Minister. Because before Modi ji came into power, I think there was hardly any skilling was done. Sir, Prime Minister sir introduced the Ministry for Skilling, to be very honest, if I am not wrong, correct me if I am wrong, but that was a special ministry created. Earlier it was with some other ministry, but it was an independent ministry was created, and the skilling was given very, very importance. The same way, housing for all, Modi ji put it into every Indian's head that they should own their house. And third thing, which helped our industry as well as all the people in our country, was COVID. Because everybody bowed down to the COVID, but thanks to all the people, all Indians here, no doubt the credit goes to Modi ji, but all us also, we also fought it very well. And lastly, the women of the house, because post-COVID, every woman told, no, they want first house rather than jewelry. They choose house over jewelry. Coming back to real estate. Real estate is one of the largest, second largest employer after agriculture in employment. today, on record, I think more than 7 crore people are employed in real estate and infrastructure. Unfortunately, more than 80% are either unskilled or semi-skilled. Hardly 18%, 17 to 18% are skilled, and 1 or 2% are manager level. So you are asking, sir, what is the basic problem? Here, when the people who are working, they are not skilled, it raises more concern, because whenever a work is done, rework has to be done, delays are there. Even safety is also very, very serious concern. If you see the accidents, whatever going on the work site, it increases the cost because of rework, compromises on the quality. Even customer satisfaction also comes to a tremendous issue. And last, the profits are also hit of the developer. Now, because you asked me both the questions together, there is a very good solution also to this. Unfortunately, today I will tell you, if you ask any young person, if he wants to work in a mall or he wants to work on a construction site, he would prefer a mall. Probably it is paid, if you really see, he is paid not half, less than half he is paid. If I think, if I am not wrong, any mall person who is working, they don't hardly get the salary in 20,000 or 25,000, whatever amount. But in construction site, a labor also earns more than that. No doubt he has to do physical work. But if he put on skilling and train the people, 100% that is going to be beneficial. So you might ask then, what is stopping it? First is recognition. Madam, there is no recognition. अगर आज आप किसी को भी बोलो कि वो कोई बोलेगा कि नहीं, आई एम वर्किंग इन ऑफिस, आई एम अ क्लर्क, और आई एम अ कंप्यूटर ऑपरेटर, और आई एम working in accounts, I am working in sales, I am working in marketing. There is no recognition, which is very, very important. See, today we are sitting in this building, which is constructed by those only people. Second, there is no incentives also. I am sorry to say that there is BOCW amount is there, that is so much amount is lying in the account. If we plan, channel it properly. And no doubt, I know ma'am, once you take it up, you are head on that. So these are things, once you incentivize them. The third one is that today, I blame to myself, we are also responsible. The accommodation what we provide to them, because we give it to subcontract, the contractors provide. And for us, to be very honest, I should not be telling it, we have more other serious problems, so we don't get into these problems. But majority of the developers have started giving them good accommodation on the site, because the staying condition or whatever the conditions are not that individual. So my suggestion is that whenever you are building accommodation, the person who has worked in construction industry for 5 years, 10 years, automatically you can tell him he can get a house that is subsidized rates, whatever. So that becomes an incentive for them. Because no mason wants his son to come as a mason. So today in India, we are talking about 2047. To reach 2047, whatever goal we are aiming, we have to go 10 times more. Today, if you see, L&T has given up in their, publicly they came, they don't have a skilled worker. The L&T itself is telling they are short of at least 30,000-40,000 workers, one company. And last, if we can, there is some e-Shram portal is there, some portal which might give them an identity card. So automatically they know, and the upgradation has to be also there. In our regular education system, once the person is done 10th, 12th or post-graduation, the same way some system we have to build it. That would be much more beneficial, I think. Thank you, sir. I think this sums up you.
Rajan,
Thank you.
Thank you. Appreciate the, I think, the comprehensive but sort of response in time. And I think you made, for me, the biggest takeaway is making a business case for dignity and recognition, right? We often don't see those things together, but I think you made a very sort of compelling argument around it. Shikha ji, will come to you now. At Tata Trust, we all know one of the sort of most reputable, you've been working in the sort of urban or poverty program space for a very long time. You've had focus on a diverse set of areas, but today I'd like to start with, I've seen your team lean into emerging sectors like care, where there is both a demand and a dignity gap, right? And so just your thoughts around how do you see care economy, child care, elder care, health, as a viable livelihood frontier for the urban poor, especially women? And maybe a little bit around the partnerships, pilots you're exploring, and what would it take to scale, right? The biggest, the hardest question, I think. Yeah.
Thank you. Good afternoon, and many thanks to the Ministry and Ishaji for giving us this opportunity. At the Trust, our work on the care sector actually came from a realization that, that most of us have, but it came from a focus and a realization that women's participation in the workforce needs to increase. We thought, as we worked on urban poverty, we realized that women need to be more proactively involved in livelihoods for a household's standard of living, for their livelihoods to improve. I think many of you are aware that currently India is ranked quite low where the female labor force participation is concerned. We are at about, I think, 37%. The global average is 48. And 48%, and India, the female labor force participation is at 37. And we are ranked about 167, if I'm not wrong. I think Amit would have the data better. But yeah, that's where we are. The point that I want to highlight is in studies that have been done, to analyze what is the reason for women not participating in the workforce, a very high number, about 45% have cited the care burden, saying that that's the reason why they cannot go out to work. And today, this afternoon, we've been talking about the vulnerable section. And so if we talk about the informal sector, which speakers before me have mentioned were about 60% of the urban economy, the situation on the women's participation front is even lower. So we have recently supported a project, and how we work is we kind of co-create programs with grantees. And a program that we recently did in, we've started recently in Mumbai area, and there we found, the studies there found that about only 26% of women in the informal settlements were participating in the workforce. So the care burden there disproportionate on the women, and also what happens as women participate in the workforce in the informal sector, their requirement of care changes. It needs to be longer, it needs to be flexible, it needs to accommodate women's requirements. So here I'll talk about two aspects. One is, of course, the demand for care, which for the informal sector, for women participating in the informal work is longer. They need more flexible hours of work. We all have domestic help in our houses. We expect them to stay back late. We expect them to come early. We do not think about who's looking after their children. And that is something that we have to cater to. So one is the demand. The other is the supply side. Where are the caregivers going to come from? And caregiving is an opportunity. I think it is a livelihood opportunity which is suited for women in the informal sector, for their livelihoods, for employment, for their entrepreneurship also. And I'd like to illustrate this with two programs. One that I mentioned that we have launched recently with an organization called Apnale in Mumbai. And this is in the I think this is M East Ward in Mumbai. Very, very, very crowded, very dense slums, no Anganwadis. Here the model that we've looked at is a community childcare model, where women living in those slums, because some women, because of their social barriers, are not allowed to go out of their houses to work. And there are other women who are going out to work but do not have people who can look after their children or the elderly. So what is the solution that can be found? And we found a solution which kind of married the two. So here we trained community women as caregivers. So the community women were trained as in caregiving. They were provided, early learning equipment. So every household or two households that took up, it kept about 4 to 5 children. They're looking after 4 to 5 children each. Since the paying capacity of women who are going out to work is also less, So the fees is settled between the caregiver and their care provider and the person who's leaving her child there. So the role that we are playing as a philanthropy is we are facilitating the process. We ensure that the caregivers are trained. We are ensuring that there is basic learning equipment that is provided. It's very, very low cost because this space is entirely the woman's. The arrangement works out very well because the woman, because they are from the neighborhood, the woman who's going out to work doesn't have to go very far. It's just 2-3 houses, 1 lane, 2 lanes. They just drop their children, and because these are people who know each other, they have a very flexible arrangement. So sometimes if the mother is working late, the lady will happily keep the child. And it also helps the woman who cannot go out to work earn a livelihood. So it is a good model, and this is something that we are trying out. So that the things that we are doing, along with the caregiving, we are also skilling women who want to go out to work, who now have somebody to take care of their children, in other skills that they've said, we want to learn baking, we want to learn this, so we're training them, we're ensuring they get linked to those schemes. And also what ma'am mentioned, in all of the programs that we do on caregiving, we ensure that the households are linked to certain basic schemes and benefits. So this is one model. The other model that we are exploring is the one where we are trying to work with the government program. There's a government Palna scheme. So how can we work with the Palna scheme, and how can we facilitate implementation of the scheme? Here, the government has the centers, the Palna centers. What we are stepping in is to ensure that the caregiving that is given in those Palna centers is up to a certain standard. So we've got an institution which is building the skills of the women as caregivers. We're also simultaneously, like the work we're doing in Mumbai, we're also trying to skill women in other livelihood options. And then, of course, the scheme. So they were looking at different models. The third model which we are trying to crack, which we haven't, and I'll be very honest, is the private entrepreneurship model. Because when a building or a space is not provided by somebody, the costs become too high, and that's where the struggle begins. So in terms of scaling up, I'll say that one is that we need to have an enabling environment. Community models need to be recognized. There needs to be some standards set for community models. Maybe what you were talking about, some easy access to credit for them so that they can, set up these small models. And then I think collectively we will have to put our heads together to see if caregiving as an entrepreneurship model can be developed, where for bigger centers, where people can get their own space and work on it. I'll stop here. Thank you.
Thank you so much, Shikha ji. As much as we see the housing and construction industry as the sort of hard infrastructure, right? And care is, I think, an equally important soft infrastructure that there's just, I don't know of a developed country that doesn't have a good care infrastructure, right? So for our Viksit Bharat, but I think there is a lot of interest in traction now. The fact that we are discussing this sort of right at the same breath as construction, and there is a lot of leadership traction. So Amit, building on Shikha ji's point, you of course, where you sit at UNDP, you work across digital livelihoods, informal work, and urban systems reform, and not only in India but other countries. So just building on the points made by Shikha ji, how critical is the care economy? Some global Indian examples where this is working, and maybe share from your current engagement on what you're doing to scale it nationally, but also what more needs to happen. Yeah, thank you.
Thanks, Krishna. First of all, a big thank you to the ministry for inviting UNDP for this forum. I think you and Shikha have already talked about the criticality of the care economy. I'll just add a few points, just keeping in view the time paucity. Yes, India is fast urbanizing. You talked about the data, and even today, if you look into, currently we are talking about 35% of populations is in India, 500 million people is currently, and which is expected to touch 40% of populations. What are the patterns that we are looking at? Why it's happening? Of course, it's migration-led, it's your nuclear family-led. If we are talking about developed India or Viksit Bharat by 2047, the simple fact that Viksit Bharat, the dream of Viksit Bharat, or the goal of Viksit Bharat, not the dream, but the goal of Viksit Bharat cannot be achieved if women's participation in the workforce. I'm not talking at the moment formal, informal, that's a secondary aspect. But if women's participation in the workforce is not equal, and if majority of our women are still not participating and contributing to the productive economy, then that definitely is not going to happen. So that's the larger kind of architecture that you are looking at. Now, deep diving into that one, specifically when we are talking about, Shikha ji talked about the female labor force participations. Of course, the data, current government data talks about 42, 43% around. However, it is primarily, there are different kind of critiques and let's say the things that it is purely driven by rural economy more. And if you look into the difference into urban economy, where what is the women's level of participation, that is still 23, 24%. So there is a huge gap between participation of women, the nature of job, the quality of job that we can leave. So women is not sufficiently participating in the urban economy, even if it is an informal job sector. So forget about the formal informality business, but only 22% of your women in urban economy is participating. And if that is the case, the reason is very clear. Shikha talked about few of that. And therefore, the whole element of the care economy being one of your critical lever, what you talked about, specifically if we have to think of what in the opening remark Isha ji talked about, if we have to build a resilient and inclusive city, right, which is basically a caring city, that's why it becomes important. It also very important from the point of view of that this is potentially a sector which is not important just from the economic value point of view, but it is also very important from the future generational point of view. Because all of us, definitely when we walk in the markets and other places, or we see in our workplaces also when the domestic help sometimes come with the younger kid, because she does not have the facility where she can leave it, and many times she just lock her child and come, then again she has to run. So what it leads to is basically reducing the hour of work that she can do, but simultaneously also it compromises the future of India's next generations. And that's basically the whole point of why care is such a critical sector if we really need to get into that one. So that's the criticality part. Now, definitely, it's not only child care, you have the elder care, the other forms of care, persons with disabilities and others. What we have been at UNDP trying to explore, we are looking at it definitely from the women's economic empowerment point of view. We work with the ministry and ULM and trying to specifically deep dive into from the child care angle. If we are talking about that, how can we create a strengthened urban care ecosystem? Definitely there are 3 or 4 key parts to that. One is the part of infrastructure, right? Second is the part of skilling, and the third is the part of financing. With our work, we are trying to kind of look into that, what are the different levers, what are the different ways in which could make a movement across all the 3 levers. On the financing side, yes, the government ILO estimates about 2% of GDP, but we know that's the fiscal space does not allow us to really do that kind of advocacy, or it may not be near-term possible. So what are the different instruments in which you could really finance the care infrastructure need or the care service provisioning need? So that's looking at the different options. That's how you can bring in not only the philanthropic capital, but also how can you try the user fee elements, which is currently missing from the public provisioning aspects. And that's one of the kind of demonstration centers that we are working in Delhi itself, where I think the myth of that the lower income urban household don't want to pay is kind of being proved wrong. For 6 months, that center is running. It's at full capacity. That's a center of 25 kids. It's running, I think even the last week when we went there, 27 kids. Most of them from lower income urban households, even a single father, because he lost his wife, he's using the services. And every month, 1,000 rupees is being paid by these, which sets a benchmark and which tells us that if we are looking to kind of creating public financing, budgeting, we can also include the whole element of that, what could be the percentage of user fee, which allows the better leveraging of the public financing. So as a public financing, we don't have to spend 100 rupees, but maybe we can look into the mix of 25-30% coming from user fee, maybe 25-30% coming from philanthropic and CSR grants, and the 50%, 40% coming from the government. So that's one aspect of it. Second element is also that's on the skilling side, we already, I think ma'am has left, we work with the Health Sector Skill Council, we have created certain curriculum because you need to leverage the system of Skill India, and that is the endeavor. That's how we can have structured and SQF aligned courses, which is kind of, we have designed it, we would prototype it, means piloting it out so that there is any kind of deficiency that is corrected, and then working with the Ministry of Skill Development, but also with the skill development missions to get the public spending on that one. So these are some of the things that we are doing. I think on the international examples and national examples, I think we talk a lot about national examples. It's known to many of us. The challenge is not about that examples don't exist in India. Examples exist. Even the Seva model of cooperative, that's a well-known model. Mobile crutch model is well-known. But the challenge is that how do we really bring it into and scale it up? And that's basically the point. That's if we want to reimagine livelihood, urban livelihood, we need to kind of transition from a livelihood promotion to what you call the prosperity transitions, right? Which requires strategic, deliberate choices, which connects human needs, capability, and opportunity. On 2 or 3 quick, if you allow 30 seconds, just on the international examples.
30 seconds.
30 seconds, that's all. And for that, I need to defer my example so that I do. So there are examples of Brazil, right? Brazil is an interesting example because we have colleagues sitting from the urban livelihood bodies. So their municipalities with the West Picker cooperative have set up, which is basically specifically taking up the need of that one, right? So that's one model, keeping in view the time I'm not getting into the details. For the home care service provisioning, there are 3 countries which are interesting examples. One is the Colombia. They have been doing some wonderful work on that one. Second, you have the Korea example. What they are doing is basically, is creating a digital registry or matchmaking platform by the government system, where the service provider are mapped, certified, and then there is a subsidy, which is again a tapering subsidy. So for low-income household, it is a higher subsidy that comes, and for the middle and people like us, there is no subsidy, but it provides a kind of matchmaking. Mexico is another example where it's basically getting into the whole system of community-based, what Shikha was talking about. Government is providing subsidy for low-income urban household, both for childcare, persons with disabilities, and other form of care. And the subsidy is being given directly to the care providers. Last example, which I would close, is Ecuador. Ecuador, over the years, in the last few years, has managed to enhance the spending, GDP spending on care from 0.28 to 0.64. And what it has done is basically it has enhanced the users 6 times availability and uses of care. And it allows, I think the point which I started with, that the blended financing or mixing of the financing. So even though it is a government provision program, it definitely has, let's say, higher subsidization for the lower income group. But it is being implemented not through a government system. It is implemented in partnership with the CSOs, community organizations, and it allows the NGOs to also charge user fee for additional services. So there is basic package, and then if the NGOs and communities are able to, want to, for the sustainability purpose. So in view of the time, I'll stop here. Thank you.
Thank you, Amit. I'll keep things moving. The only thing I'll say is, I think that large-scale finance, figuring out large-scale financial instruments, right? Not only at the last mile, but also how the sector is funded is equally crucial. And I think when we have an opportunity, Amit has been doing some work around what is the size and what sort of instruments do we need to scale this in the country nationally. I'll keep moving. Vasanta ji, thank you so much for your patience. Appreciate you sort of very, very patiently waiting. We'll switch gears now. Vasanta ji is the advisor for the Ministry of New and Renewable Energy at the Government of India. You've been closely involved with MNRE's work on the inclusive energy and clean energy access, right, and livelihoods. We've seen promising models like solar didis. We hear a lot about solarization and linked with livelihoods in rural But urban poor women and SHGs, or it doesn't have to be SHGs, but it's kind of, we don't hear much in the urban context. So maybe a little, so your insights around what is MNRE doing to change that, what kind of policy or partnerships model could help cities and the segments we care about tap into green economy jobs, and how can we scale it again? Thank you.
Thank you. Actually, maybe I am odd man because housing and poverty, because I am talking about energy. But I mean, I can integrate with renewable, how renewable energy can play an important role for in green economy. So yeah, in line with the global energy transition, our country is also, we are also progressing towards energy transition. So in that, the Panchamrit target of, one of the Panchamrit target, that is the 50% renewable energy installed capacity by 2030. But we have achieved, I mean, I'm very happy to share that we have achieved that target 5 years before. In 2025, June 2025, we have achieved the 50% renewable energy installed capacity. And the other one, that is the 500 gigawatt of non-fossil fuel energy by 2030. So the major segment is the renewable energy, that is 485 gigawatt of renewable energy. So that renewable energy is now at frontier for employment, for creation of employment, and also the entrepreneurship, facilities. So now the 500 gigawatt of renewable energy capacity is going to give the estimated direct employment potential of 38 lakhs by 2030, and also 1 crore jobs by 2047. So the renewable energy, that is, I mean, there are various different energies are there: solar energy, wind energy, small hydropower energy, and bioenergy. So MNREs, we have in 2015, we have the Jawaharlal Nehru energy mission, that is solar mission. In that we have only 20 gigawatt of solar. But in 2015, the 20 gigawatt, by forcefully, the 20 gigawatt, the ministry has given the target of 100 gigawatt of solar with 18 rupees of rupees per unit. And then, of course, I mean, with the targets, investors will come, policies will come. But ministry has realized that the need of the human resource, the very important part of the, that is the human resource. So we have initiated, although ministry has short-term trainings before that, but we realized that industry-linked the skilling program should be there so that the skilled people can get employment. So with that, the flagship, at that 2015, we have Surya Mitra program, that is solar PV technician program was evolved. And then in that, of course, in line with that, in 2015, we have the creation of Ministry of Skill Development also. And also we came up with the some guidelines, the structured guidelines. And ministry has followed all the guidelines of the Ministry of Skill Development. So in that, the unified course curriculum, with the initiation of the Surya Mitra program, the skilling system for solar energy came up. So unified course curriculum and the strengthening of the training institutes, and also the employment linked. I mean, we have, in that program, Surya Mitra, we have 50% of employment. That is the recorded employment rate is there with the 3 months of skilling program. So although Ministry of Skill Development gave the guidelines, but they didn't follow in PMKVY, but MNRE has followed in that Surya Mitra program, and we got 50% of employment in that program, because we have forced training institutes to have the MOUs with the industries, so that the last tranche of the 30% of the fee, that will goes to them only when they can give the 75% of the employment of the batch. So Of course, the success, I mean, the Suryamutra program has implemented up to the last mil, the rural, because the solar energy, solar projects are in rural. So with the success of that, we have initiated the wind energy also, Vayumitra program, and also small hydropower program. And now here we have implemented some innovation, because of course solar is everywhere, but wind is not, the wind potential is not there. And then because here we came up with the location specific skilling. So that is the only, we take up those programs in the location specific, that is the those energy potential states only. So there the employment rate also, and there we have initiated the on-job trainings, 50% of on-job trainings, with the 50% of classroom, with the 50% of on-job trainings. So in that also we have, which the success rate is coming up with to 60%. So with the success of it, I mean, I want to share the policy, how policy can then can give focus to the skilling. One of our flagship program, that is Pradhan Mantri Surya Ghar Yojana, PM Surya Ghar Yojana, PM Surya Ghar Muft Bijli Yojana. In that, we kept 1% for the capacity building. Skilling programs, because the scheme is for installation of 1 crore RTS systems, 1 crore households, RTS systems in households. So there, the implementation of the skilling system, we have all the, I mean, stakeholders in that. The trainers, we are having programs for trainers and master trainers, and also entrepreneurs. We are giving vendor training programs, that the technical with entrepreneurship, how hand-holding, how the persons can transform into the entrepreneurs. So with these activities, the states are also coming up. The women, the state-specific programs, that is Mumbai Solar Didis, and the Surya Sakhis of UP, and also the Solar Sahelis of Rajasthan. So all these programs, they are coming into the women, I mean, they are giving livelihood to women, and also now the technicians all are transforming into the, they are transforming into the job seekers to the job creators. So thank you so much.
Thank you so much, Vasanta ji. Ma'am, with your permission, couple of questions only, 1 or 2 minutes, is that okay?
From the audience, so that I know that they're up.
Yeah, I think our panel
so
has been...
all have had tea, coffee, so I think 1 or 2 questions quickly from the states, from people who are our partners. Because we have another 3 set of very exciting presentations lined up from the states, by the states, and also from one of our sister ministries. So, any questions, anyone?
Hello, my name is Dr. Mukhtar Alam, and I represent a national organization called Janpahal, and we are nurturing a network called Gig Workers Association also, which is a national network. So we are very much enthusiastic, especially about the new DJ occupational group selection, and gig workers and platform workers are part of that, apart from other 6 occupationally vulnerable groups. And we would like basically the new access to credit of 1 to up to 4 lakh, which is being piloted in 25 cities. So basically, I don't have any very specific question, especially to this, but then I just wish that some kind of integration takes place, especially in access to credit, finance access to credit to the gig and platform workers, number 1. And also, how this, because we are basically ensuring that, that 100% uptake of entitlements takes place. So we will be also urging, especially to this, Tata Trust and all such CSR bodies, that, that they may come up, to ensure that, that this uptake of entitlements, gets 100% in the coming years. Because, this thing, right now, we have a progress support, from Azim Primary Foundation. But as a vision, so my observation is that, that the vision will be successful if, we get kind of, 360-degree support, from all sectors.
So thank you. The point around credit and entitlements is well noted. I'll let ma'am and anybody else provide a quick response.
Would you want to speak about the gig workers that Telangana is also So basically, it's about the new scheme that you're asking, and I'm happy to note the study that ma'am has shared today. So most of the categories that ma'am showed on the screen, we're covering all of them in the upcoming mission. So all the categories from the domestic, so it was kind of a fact check for me as well. And surely these slides, ma'am, would definitely help us strengthen our case. So all these categories we are catering to. And apart from that, there's one particular category that we added, that was home-based workers. So now we have 7 focus groups that we would be working on in our upcoming schemes that we are designing. And when you speak about, the new missions, so the new mission, as I spoke in the beginning, because it requires all customized project for various things. So, you must have seen that in the pilot, you've given a lot of loans. But one question people used to ask us, कि हमें नहीं पता चलता कि इस person को किन-किन चीज़ों के लिए हम दे सकते हैं. So now we have designed sub-categories. So if it is a domestic worker, now, he can be a security guard, he can be a gardener, he can be, a person who's working in someone's house. So we have different subcategories in domestic workers also, and we have different loan products for different people. So for individual, different, and for group, different. For example, if a person wants to have his own laundry business, so that corpus he requires is much different as compared to if he wants to start his sewing machine and some small business. So therefore now when you see the products, they're much more detailed out, and it's all because of the feedback that we've received with you from the states. Now we have specific detailed products for every category, and 7 categories we are covering. And we have roped in National Housing Bank as our implementation partner, because the scheme now would be a lot of microcredit based. So we are an enabler that we are providing them access to credit, and thereafter they would be setting up their own self-employment ventures, micro-enterprises, and we also have the element of entrepreneurship building. So for that, I am Calcutta, I am Kozhikode, we are coordinating with. So exactly on the similar lines, so we are still in the process of structuring it. So any feedback that, many feedbacks that we have received today, so convergence, social security, making the database of urban poor, profiling them, all these things have been built in the mission so that it's a comprehensive database of urban poor. We also have convergence element with all the social welfare schemes, entrepreneurship development, and customized microcredit facilities for each one of them. Thank you.
Thank you so much. I will not summarize this and end in 30 seconds, but I definitely need to thank stellar panelists who did an amazing job in providing concise but sharp remarks. Thank you so much. And ma'am, to you for leading and steering this work, but also to, I think, all of you in this room and building, think what the policies you will make and implement will determine the future of sort of our inclusive and equitable growth in urban India. And so thank you. And I think the public-private community partnerships approach that you're taking, inviting us here, shows sort of the willingness to partner, and we are of course very happy and proud to be engaging and partnering with you. So huge thanks to all of you, the panelists, and all of you for engaging with us. Thank you.